Rising health care costs, Supreme Court challenges, and even more problems with the website. Well, 2014 was a big year for Obamacare. So where does the health care law stand right now?
For decades, few things exposed hardworking families to economic hardship more than a broken health care system. And in case you haven't heard, we're in the process of fixing that.
2014, the year that put the Affordable Care Act to the test. But what happened? It starts January 29th. On the Record reports that at least 43 convicted criminals are working as Obamacare navigators in California.
In California, there are 43 people working as navigators right now who have criminal convictions.
Days later, February 4th, the nonpartisan Congressional Budget Office announces that Obamacare could cost 2.3 million jobs, creating more headaches for the administration.
Their analysis is not complete. It doesn't reflect the full set of factors.
April 1st, President Obama makes a major announcement.
7.1 million Americans have now signed up for private insurance plans through these marketplaces. 7.1.
And 10 days later, Secretary of Health and Human Services Kathleen Sebelius calls it quits.
Kathleen Sebelius, my Secretary of Health and Human Services, told me she'd be moving on.
June 30th, the Supreme Court makes its Hobby Lobby decision, allowing some companies to refuse coverage for contraceptives. September 4th, the administration announces that healthcare.gov hit with a major cyber attack. September 18th, some good news for the law.
We have 7.3 million Americans enrolled in the health insurance marketplace coverage, and these are individuals who have paid their premiums.
November 7th, the Supreme Court accepts a major challenge to the law, a case that could determine the fate of the entire Affordable Care Act. November 10th, this video goes viral.
Lack of transparency is a huge political advantage. And basically, call it the stupidity of the American voter or whatever. But basically, that was really, really critical to get anything to pass.
Jonathan Gruber, the so-called architect of Obamacare, caught on camera again and again.
The American voter is too stupid to understand it. Basic exploitation of the lack of economic understanding of the American voter.
And November 20th, the administration admits it had the numbers totally wrong. All those sign-ups? Yep, way overstated. And then, November 25th, friendly fire as a major Democratic senator slams the law.
We took their mandate and put all of our focus on the wrong problem. It wasn't the change we were hired to make. Americans were crying out for the end to the recession, for better wages and more jobs, not changes in health care.
So what challenges are ahead for Obamacare in 2015? Our political panel is back. All right, Aaron, thoughts?
I think the big one is the Supreme Court case. This is really, if the law is going to be overturned, this is where it's going to happen. At issue here is basically whether the law was intended to allow subsidies for states that didn't set up their own exchanges. A lot of states didn't do that. If this is, in fact, interpreted to be the intent of the law and the way that it's written, that really undercuts the entire law. It's going to be very hard for it to continue to be implemented.
Jackie.
I agree with Aaron, but I think, Congress is going to keep the pressure up. I think there's going to be some maybe more symbolic type votes going on. But I also think they're going to try to whittle away at the law, and there is some bipartisan consensus about things like repealing the medical device tax, and that's going to be a big challenge for the law. I mean, President Obama's going to veto it, but they're going to try.
Yeah, Bob, I mean, a lot of this stuff has been backloaded in Obamacare. There's going to be some surprises coming up for people, some costs, some money associated with that are really going to make consumers and Americans very unhappy. They're going to have to face these challenges, too.
Yeah, and Kimberly, remember, you have the implementation of the individual and the employer mandate.
Yeah.
That's going to be very big. They have been long delayed because they are implementation nightmares, or could be. So, the average Joe or Steve on the street who doesn't have health insurance, well, he could be fined.
Yeah, see, that's the problem. When you think about this, they purposely did this because they couldn't handle too much bad news at once, especially when it was a failure to launch, Aaron, with respect to the website. Now the real meat and potatoes are going to start to hit the table. It's going to be a problem.
Yeah, and I think Bob made a good point that there's been a lot of delays over the course of the law's implementation. We're in an enrollment period right now. Things seem to be going okay. The enrollment numbers were overstated, but they got close to their goal. There's actually been some good news on this front, but The real thing here is the Supreme Court. Comments like Jonathan Gruber's obviously don't help. Comments like Chuck Schumer's obviously don't help. Those were tremendously unhelpful for the administration when he said that they really shouldn't have gone after health care as their first big ticket item.
Yeah, Jackie, a lot of people out there feel that they've been hoodwinked, you know, as consumers. They were promised one thing and got an entirely different thing altogether. That's why they're upset. And then when you have that on the heels of Jonathan Gruber's comments, I mean, it's demoralizing.
Yeah, and I think those comments in particular really reinforce some of the concern a lot of people had about Obamacare. You know, I think Democrats want to make sure that this is working at least adequately so their nominee isn't dealing with this in debates coming up in 2016.
So if you're Republicans, Aaron, what would you do? What do you do to try and make the most of this situation? Because they've been given essentially a mandate by saying, hey, we're voting for you, we put you in the midterm elections, so now what?
I think what you're going to see the Republicans do is they're going to do the repeal votes. They're going to get this through the House and maybe even the Senate, depending on the filibuster rules. It's going to go to President Obama's desk. He's going to veto it, and they'll say, well, here's what we did. We tried. The only way the American people can get rid of this law is if they elect a Republican president in 2016, and that's going to be their argument going forward.
Bob, do you agree?
Yes, I do. And I think overall, I mean, Democrats have now divided. They repeatedly said for years, this will be popular. Just wait, just wait. And Democrats right now, including Schumer, are tired of waiting. And they're acknowledging, hey, this is not that popular. And that's why I think the president and the White House officials going forward are going to be talking a lot more about the economy than about Obamacare.
All right, well, we'll see what's in store, but this is another big one for 2015. Let's see if we can change some things with respect to Obamacare and perhaps maybe some bipartisan support. All right, thanks.